Okay, and when I was talking about demodex, which is a mite, and the difference is demodex is typically found within the hair follicle and is a normal resident on the skin. So when we see that demodex infection, then typically, normally the animal's immune system keeps it in check and keeps it from becoming an infection. So typically, in most of these patients, there's an immunosuppression. It could be that they're fighting another illness, which can make an animal temporarily immunosuppressed, or they can have primary immunosuppression genetically. And then because the immune system doesn't prevent the mite, it can proliferate. Now, we talked about localized versus generalized. So they can have one spot, they can have demodex kind of affecting them all over. And then I talked about pododemodicosis is where maybe the lesions are only on the feet, and then otodemodicosis where it's affecting, and most of the time it affects the pinna. It's more like an otitis externa, except that if they itch the ears bad enough and cause erythema, then it can cause a secondary infection. And the big problem with the ears, remember, the ear canal is just the dog's skin rolled up in a tube. So a lot of ear problems in animals are rooted in a primary skin disorder. And one thing I will say about ears, I'm kind of jumping around, but um, ear anatomy in dogs, in cats, their ears are uniform, horses, cattle, but in dogs, different breeds have a different shape to their ear canal and also the pinna. So the problem is in like a basset hound or a bloodhound and a cocker spaniel. And cocker spaniels traditionally have terrible ears. But the problem is their ear pinnas are like mud flaps. And what happens is they're so heavy and they're so long that they can trap moisture and infections can proliferate. So any dog that has that very long pinna and it's very heavy and it's against the canal, that can again trap things. And dogs like that are usually prone to more ear infections. But anything that affects the outer ear, primarily the pinna, can migrate to the inner ear and cause a middle or inner ear infection. And so to diagnose it, you have to do a skin scraping. And I said one of the keys to doing a skin scraping is you're not just going to scrape the surface. Generally what I do is I pinch the skin in a couple different places and kind of squeezing the dermis. You're really kind of trying to squeeze out that mite from the follicle. And when you scrape, if you actually get blood, the blood supply is under the epidermis. It's in the dermis and the hypodermis. Now, we're not going as deep as the hypodermis, but once you start to scrape and get a little bit of blood with your skin scraping, then you know that you have achieved a normal skin scraping. Now, skin scraping is a skill. The skills in this class are going to be towards the end of the, probably we'll do those around week 8. We do necropsy on a rat, and we actually practice the skin scraping on the rat. So we're not going to take live animals out of the kennel and do skin scrapings. We're going to practice on these cadavers, and that's usually how we'll do the skin scraping. So we won't get blood because obviously they're not alive, but you're going to get the gist of how to do a normal skin scraping. And again, it's usually going to be positive if we find a large amount. The other thing about the last note here is a biopsy can be performed. If it is highly suspected that they have demodex and we're getting negative scrapes, and this, I've not seen this done a lot, but if you biopsy the skin, and when you biopsy, you take a piece of the epidermis and dermis, and then you can send it to the lab, they may find evidence inside the biopsy. So that would be another potential. The treatment, some keys here, is that sometimes in the dogs, the younger dogs, they will resolve on their own. Maybe they were fighting another infection, the immune system rebounded, and the immune system takes care of the infection. The big thing here is we don't want to use steroids. And this is why when a dog is itching and it comes in, if you suspect demodex, you don't want to give every dog pred because, again, prednisone or steroids are immunosuppressive. Well, the problem is the immune system is part of what fights this infection. And if we suppress the immune system, it can make the condition worse. So again, anytime you think of steroids, think immunosuppression. Now, sometimes we do that on purpose, but if you don't want to suppress the immune system, you don't want to use steroids as a drug for treatment. If it's localized, you can, it may take a month or two that it'll resolve. There is some topical therapy. Probably one of the number one treatments that we do for demodex is what's called a mitaban dip. Now, mitaban is the trade name. Amitraz is the active ingredient. If they have a lot of hair, it's actually recommended to actually trim. Maybe just, you don't have to shave them bald, but if they have a longer hair coat, you want the dip. So what a dip is, if you've never talked about dips, a dip is a chemical treatment, and it's typically a concentrate, and you will add a certain amount of the dip to a gallon of water. And so normally what you do is you shampoo them and you rinse off the shampoo, and they don't always have to be shampooed. You may just do a straight dip. But what you do is you're going to pour the dip all over the animal. Be very cautious around the eyes and the mouth because you don't want to get it in the eyes. It's a chemical. And the dip is going to have to penetrate the skin, and it's going to sit. And that's why sometimes they might say trim the fur, because, the fur, if it soaks up all the dip, that's not where it needs to take effect. So a lot of times you can pour the dip over an animal. You could sponge it, take a sponge and sponge it on them. I usually would. And it usually has to sit for about 15 minutes. So you're going to pour this on, and they have to sit in the tub and let it kind of soak in. The key here is that you don't towel dry them. You don't blow them dry. You're actually going to have to put them in a kennel or a run after they've sat in a tub and let it soak in. So they're going to go home smelling like chemical. I always kind of warn the owner that, we don't want to rub it off. We really want it to kind of get onto the skin and soak into the feet. Now, these dips can be repeated every 2 weeks because, again, remember, you're going to have the active mite, but you're going to have like larval stages. You're going to have those young stages that are going to continue to emerge. It could, in severe cases, need 10 to 15 dips. So this may take several treatments, depending on how severe the demodex is. Some key things about Amitraz or mitaban dip. There are some side effects. They can get anorexia and vomiting. It can cause some pruritus. The problem is they probably were already itchy. But you put this chemical on them, and it can sometimes irritate. The big things we want to watch out for is there any ataxia, any stumbling, sedation, or bradycardia? And those are all signs of kind of like, maybe they absorbed too much of the dip, or that animal is having a reaction to the dip. So we don't typically. Right. So Beth, that's true. So another situation, I didn't talk about it with flea allergy dermatitis, but if you do a flea bath, a lot of animals are flea dipped. And again, most dips are designed to not be rinsed off. They kind of soak in, and especially in flea dips, they can leave behind a residue that will hopefully repel more fleas. So that's, again, why you kind of want that chemical. Again, I tell them at home, for the owners, they may not want to let them on the couch or pet them. Maybe they need to wear gloves because there is going to be some residue on them. Sometimes they look a little bit greasy. Sometimes it leaves like an oily residue. Eventually, they can have a bath to kind of clean them after the dip, but that might be a couple weeks You know, if it's a couple weeks after the last dip, they could come back in for just a general bath if they want to. But immediately the dip needs to stay on. Um, do not use sedation. It's not like I'm going to sedate the animal, do a nail trim, and do a dip, because the sedative, you're trying to evaluate the animal to make sure they're not sedated, they're not ataxic, they're not bradycardic. So if you're using sedatives at the same time you're doing dips, you're not going to be able to evaluate, is the sedation from sedation or is the sedation from the dip? So ideally, they're kind of in, you know, some owners are like, give them their vaccines, clean their ears, dip them, sedate them. You know, sometimes they give you like a laundry list. If they're there for a dip, that's pretty much, you know, we want to evaluate because this is a chemical. And the prognosis, if it's localized, it's a better prognosis than when it's generalized. When they have it all over their body, it's a little bit guarded. And the key here is that diagnosing the reason, again, most of these infections are rooted in some immunosuppression. Why was that animal immunosuppressed? So kind of figuring that out, and then that's going to kind of lead to the prognosis. And if it's an adult dog, now again, that's young dogs. If it's an adult dog and it's localized, again, we're still concerned about underlying disease. And if it's generalized in an adult dog, it's a poor prognosis, because is there a disease underlying causing immunosuppression, which caused, against the demodex a lot of times is a secondary reaction to a primary immunosuppression. So we got to get to the reason for the immunosuppression, and that's going to kind of dictate the prognosis, depending on what the underlying condition is. There are some other demodex mites that can affect bovine, again, is cows, ovine, or maybe sheep, equine, did I say that right? Ovine and caprine are goats. Where's my sheep goat people? I'm brain right now. All I primarily want you to know is the dog and cat demodectic mite. For our, and are there any questions about demodex? How do I get out of this? Oh, there we go. Okay, so let me talk about pyoderma. And this one I loaded onto the Moodle page. There's like a list of different notes. And a pyo means pus and derma means skin. So it's literally a bacterial infection of the skin. But there are two forms of pyoderma, and it's either called superficial or deep pyoderma. And most of the time, this is why the client comes in. They notice like the red bumps, and then, you know, or maybe they notice that their pet was scratching, and then they look at their belly and they notice all these red like pustules. And all of a sudden they're like, my dog has all these bumps, and that's why they come in. And what I want you to realize is that a lot of the pyodermas are rooted in a secondary reason. Anytime an animal scratches their skin, they can get a pyoderma. They can get it with fleas. They can get it with environmental allergies, with food allergies. So pyoderma is a lot of times happening because of another skin reason, and then they develop a pyoderma. So normally there's some things in the history is that he always gets this rash when the trees come out, or I started this food and now he's itching and he has a pyoderma. And, you know, is the animal on any medications, any antifungals that would kind of point us into a direction of the disease? Now, if we talk about superficial pyoderma, there's a condition called acute moist dermatitis, and most of us refer to those as hot spots. If your dog has ever gotten a hot spot, usually and sometimes they happen on the face, they can get them on their hip. And there's like an area, it's almost like if you imagine if they abraded the skin, if they scraped themselves, if you've ever skinned your knee and it gets kind of red and inflamed and sticky because it oozes serum, that's what a hot spot looks like. And so if they get, and sometimes they can get acne, and most of the time acne affects cats a little more than it does dogs, and a lot of times it gets right on the chin. The other place I think about pyodermas is dogs that have a lot of folds, especially around their face, sometimes near their paws, sometimes near the rump. They get what's called skin fold pyoderma. And if you open up the fold, it's kind of red and sticky, and it might have an odor. So that's what skin fold pyoderma, um, a hot spot, and acne. And again, it's usually just the superficial, it's usually just the top layer of the epidermis. And a lot of times it's self-limiting. It might, well, I'll give you an example. My old golden, the problem was if you shaved, like she had a catheter put in, and where they shaved her skin and scrubbed it, a week later, because she was licking where she was shaved for a catheter, it turned into a hot spot. And I knew for her, if we shaved her fur somewhere, more than likely she was going to lick it and it was going to turn into a hot spot. So the constant licking caused a superficial irritation, and it would get kind of sticky. And what I'd do is I'd put some ointment on it, I'd put a bandage on it, and then usually in a week or two, it would look normal. The hair would grow back. It didn't feel thickened. It pretty much looked back to normal. So if it's superficial, it doesn't usually leave scarring. The fur should grow back. And the big thing that the other thing is, if it's superficial, the animal isn't ill systemically. The only issue is the local area. And what I want to say about hot spots, a lot of times they're self-inflicted. For my dog, she licked that spot over and over and over again. And the key thing that I tell owners, it's not going to get better unless you stop them from licking. If they have to do an e-collar, and I hate e-collars, I mean, but if your dog is licking a spot raw, the only way it's going to get, you either have to bandage it or cover it, but not all spots can be covered with a bandage, is if you put an e-collar on and they can't cause self-trauma, it's not going to get a pyoderma. So a lot of times the number one thing to tell owners is you gotta protect it. You gotta, prevent it. It tends to be very red and it tends to be moist. It can feel warmer than the other areas of the skin because it's inflamed. And again, the heavy coated water breeds are predisposed because, again, the heavier fur traps moisture, and moisture can contribute. Now, when a dog licks, that's where they get their moisture. Yeah, I mean, and that's the thing. You have some dogs that, I will tell you, some dogs might have a painful area on a limb that they lick over and over again. Sometimes it's from, like, they get like a bee sting or a spider bite. Sometimes it's where the skin was clipped. I mean, anything that caused them to focus. Yes. Yeah, there's some dogs that are just over obsessive about that, and that it does become kind of a chronic problem. If they keep getting a lick granuloma or a pyoderma or I'm sorry, I should say a hot spot, if they keep getting it in the same spot, eventually that area can become thickened. It can get kind of hyperpigmented. Sometimes you'll see salivary staining. It'll look a little red, that rust staining that they get from saliva, because you can see that they constantly lick one spot. It tends to be worse, again, when it's in this, when you get to the spring and it's rain and it's summer and there's heat. Typically you get these red, moist, painful patches. They tend to have hair loss from over chewing or licking. Typically the way that we clean it, most of the time, is we clip the hair, and you got to be careful when you clip it because you don't want to irritate it. But If it's got a bunch of long hair stuck to it, you got to get that hair off. So we usually clip it. And you can clean the hair with like a medicated, you can do either like a spot shampoo, you can do an overall shampoo, or like a chlorhexidine scrub. Chlorhexidine is that blue, it's actually Novosan, but there's also chlorhexidine acetate, which is the pink one. There's different forms of chlorhexidine, but usually that's the kind of a scrub that we keep in a container at the hospital. You just scrub the area, rinse it with some saline. You can do topical meds. You don't necessarily want to dry it out though. So most of the time you can do, I've told owners they can get Neosporin over the counter. Again, the problem with using topicals is you can't let them lick it off. It has to contact. So you can put on the topical and put a bandage over it. We had a dog that had radiation thermal burns, and we had the owner get t-shirts, kid-sized t-shirts, and she put a t-shirt over that. She put the ointment on and put the t-shirt on the dog. So you know, there's a variety of different ways, e-collars, bandages, t-shirts that you can cover, but anytime there's a topical, it has to have contact for 30 minutes. There is also gentamicin spray. Now, gentamicin is an antibiotic, and it comes in like a little pump spray, and you can spray the gentamicin on usually a couple times a day. A lot of times, the reasons for the hot spots is typically rooted in fleas. It can be allergies, but sometimes something was done to it. Like I said, my dog, it was usually if he was clipped, if his fur was clipped to the skin, he would lick. So a lot of dogs, I will tell you, post-operatively, I always warn owners, you know, where we place the IV catheter. I said, watch them for licking where their IV was. If they continue to lick where they're, because the catheter, sometimes catheters are left in for 2 to 3 days, and it kind of feels itchy, like when they go home because it's healing. But there was also adhesive on the skin. We clipped the fur. So a lot of times the post-op catheter site was an issue. So I tell owners about that. You can do steroids, and you can do a systemic antibiotic, like an oral antibiotic. Steroids, like prednisone is a tablet. You can do an injection of, like, we used to use a long-acting steroid. It's called Vetalog. And it was an injection, and it would last 3 weeks. So we'd give them an injection of Vetalog. Now, it's a very powerful steroid. It usually will calm down the itching, and they may stop licking because they don't feel itchy. So steroids can help treat a pyoderma. And then again, cephalexin is an oral capsule. Enrofloxacin is actually Baytril. Cephalexin is a good skin antibiotic. That's probably the gold standard. Baytril is pretty strong. We don't typically use Baytril for skin infections, but if you have a stubborn one, we maybe go up a grade. But again, steroids are usually only used if the animal is like incessantly pruritic. Like if they're just so itchy, they won't stop bothering it. Because again, steroids are immunosuppressive. They will improve the itching, but part of healing is inflammation and is the immune system. So the problem is if you suppress it, it can actually delay healing. It's kind of like a double-edged sword. So it may just be antibiotics, no steroids, antibiotics and steroids. You can also use products that have topical steroids, and the dog doesn't get an oral systemic steroid. Sometimes like gentamicin spray and certain topicals will add a steroid that will kind of chill out the local inflammation. They're not as strong. You know, obviously oral prednisone is stronger, or a Vetalog injection is stronger. But I want you guys to understand, like, when you would use, you know, and obviously that's the doctor's call. And normally the big thing that we tell client info, and in most of my med classes, I like to stress what you need to know to tell the, because you're the one that does the client. You're the one that sends these pets home. What do I as a client need to know? Just like when I gave you that test question, like you're sending home AJ, if I'm picking up my dog with a giant hot spot on his face, how do I take care of it? Well, first of all, you know, using clean hands to clean the area, clean the lesion. But the big thing is preventing them from chewing or scratching that area. And what I told the owners, it's frustrating. People like to take e-collars off. And I'm like, but I could tell a dog that would come back in 3 weeks and it looks just as bad as when he came in 3 weeks ago. And, the owners are like, oh, I only took off his e-collar 1 or 2 times. We can tell evidence that the dog has been licking. And like, what's funny, what Jasmine typed in the chat, I had a dog go home after radiation treatment, and he had the t-shirt because, again, we were treating, and the dog, we could see evidence that there was trauma to the area. So we're like, well, you're not keeping the t-shirt on, or you're taking off the e-collar or something. And she's like, I swear I'm doing everything you say. The dog got outside up next to a bush because she watched him, and he would rub against the bush. It would get the tree branch, or the bush branch would get under the t-shirt, and it was scratching the area. So the owner was doing the e-collars and the t-shirts, but the problem was the dog figured out a resolution. Or this one lady, the dog was rubbing up against the couch and it was rubbing the face. And so he was able to get the e-collar, the couch, they're creative. So you have to watch them. Yeah, I mean, like Morgan said, I mean, yeah, like Rachel's saying, another dog might be licking the area. They might be getting into the fence and getting part of the fence to scratch them. So, when you let them outside or they're with your other pets, these are all things to tell an owner, because, they have to know how to do it. Now, acne is, you can get in the young dogs. They tend to be the short coat breeds, and sometimes their little short fur can sometimes what happens is if their skin overgrows on their chin and their little fur kind of gets trapped in the follicle, it can cause irritation. It can cause the bumps. So it's a little more prominent in, well, like I got boxers, and I'm always checking their chin because my boxer's got folds underneath, and AJ's got some folds around his face. So I'm always kind of like, are your folds all clean? Is your chin all good? The feline acne is pretty significant, and it can affect cats of all ages. But the problem is with cats, their chin can actually get very swollen and very painful if they get this acne. What it tends to look like, again, if their chin is red and swollen, and sometimes they're sensitive, like you go to touch them by their face and they react because it's swollen and painful. You can sometimes see papules, which are like little red bumps. Sometimes you can actually see the dark spots on the chin, or actually large comedones, which are actually blackheads. You'll actually see little black spots and little swollen follicles. And that's all, normally what we do is you can clip the hair. You have to be careful because sometimes the chin is irritated, they're sensitive. And you can cleanse it with a bacterial soap. Sometimes we'll tell clients, go to the store and get benzoyl peroxide, like Stridex pads. And I don't even know if they're still a thing anymore. I feel like this is an old thing. They're the little circular pads, and they contain the benzoyl peroxide. And you can clean their chin with it. It actually can over dry, because what it does is it gets into the follicles and it penetrates the follicle. It's keratolytic keratin, so it'll break down the keratin layer, which is protective. It'll penetrate, but sometimes it can get too dry. So you can have the opposite problem. You're starting to clean up The okay, so good. A lot of people use it, but I know sometimes people that use Stridex pads, and just like people, sometimes you use it and then your skin gets kind of red and dry and crackly, and then you're kind of itchy and painful from your irritated skin. So you just have to see how they respond to that treatment. We used to also, my old cat that I had to just put down, he occasionally would get the red bumps and the black. I could see the black bumps. And sometimes I would sit there and I'd really scratch it and he'd be really like, oh, you know, and I can sometimes, I know it sounds gross, I could kind of pick off the scabs, and sometimes I try to squeeze them for him and and I could sometimes get out some of the blackheads. Um, Now, you can try to use antibiotic ointment. The problem is, again, keeping it there on the chin. You know, they're going to want to rub it off. Um, and they may need antibiotics and steroids if the chin is very swollen and inflamed and painful. Then you may have to put them on, you know, like when I say systemic medications, that's either via injection or via an oral medication. And then that treats it systemically. Um, and the feline acne can actually affect the whole lip and the chin, which I've said can be swelling. You can get crusted. Even they can get crust there that you have to pick off. It's usually a lifelong problem. Can be immune issues. This cat that I just talked about, in addition to his chin acne, he always had crummy ears too. And so it could have been us. Now, he didn't scratch his fur and he didn't have any lesions on his body, but he would scratch his ears and he would get the chin acne. I did say, you know, you can put a note here somewhere. There is a theory that certain plastic bowls can make this acne worse. And so he used to eat out of this plastic dish. A lot of the plastic dishes that you see now are coated with products that are supposed to help prevent bacterial growth in the bowls. But sometimes in the plastic, because they keep putting their mouth in their bowl, the chin is reacting. And usually, so what I did is I changed him to a ceramic bowl. I got rid of the plastic bowl and he did improve. It didn't completely go away, but he was much better than so sometimes I'll tell owners, switch the bowl, go to like an aluminum bowl or potentially a ceramic bowl. Also make sure the bowl is clean, because sometimes people just keep putting food in the bowl. And if there's bacteria, then that can cause, and you know, like I said, they're putting their face constantly in the bowl. That can cause an infection. So a lot of times, most of the time, feline acne is treated topically, cleaning the chin, changing the bowl. In severe cases, they may need medication, and I never screened him for immune issues. I'd clean his ears when they would get bad, and I would scrub his chin when it would get bad. But only one time did he get really swollen, and I had to clean him a lot more. The skin fold pyoderma, anywhere they have extra skin, any flap, you know, near the lips, sometimes near the commissure of the lip. You know, of course, AJ's not going to make an appearance. AJ, right between his eyes and his nose, he's got folds. But, you know, I think about bulldogs, Boston Terriers, especially like Persian cats. Persian cats have that smush face, and sometimes where the tear, sometimes they'll get tear staining, but that tear can get in the folds. And the other problem is sometimes near the tail, if they got folds near their tail, there's something in bulldogs called screw tail. And when you trim a bulldog's tail, it actually looks like a corkscrew. Oh, Shar-Pays, thank you. Amen. Near their tail, the problem is they secrete a lot of sebum there. And sometimes that excess sebum gets in the folds, and then that fold traps that moisture. And then it can get these folds, yes. And so typically they trap the moisture, and then what happens is they rub because the moisture causes an inflammation. And then they actually rub it, and it gets these secondary pyodermas, or these infections. The only problem is now, well, let me talk about the vulvar folds. There is a surgery called the vulvoplasty. And what they can do, the problem is some dogs have what's called a tucked or hooded vulva. Sometimes they have so many folds it covers it looks like a hood over the vulva, or sometimes the skin folds push the vulva in and they trap. Whenever they urinate, they trap. They can urine scald and it traps moisture. The doctor can make these crescent moon-shaped incisions, and what they do is they tack the skin. It's like we pull the vulva out and tack it, and it's kind of like doggy plastic surgery. We did it to a bulldog when I was at Purdue. We cut some skin here and we tacked it up. Um, yeah, I mean, a mastiff, a bulldog, and the problem is, and without getting on too much of a tangent, you know, when they spend money on a bulldog and then it has these skin fold issues and then they have these breathing issues and they're like, oh my God, but I spent $1,500 to $2,000 on this dog. And they get very upset when they have to do these surgeries. And it's like, but these are very genetic known problems with this breed. And when you get them, anybody that's going to buy a bulldog, I'm like, I hope you have a piggy bank that comes with that dog, because genetically they're predisposed to so many things. So if it's chronic, you can remove the skin and do surgery. Normally what we do is you can try to clip and clean the area. You can actually use cornstarch. My old golden, the female, it's kind of weird. She had hypothyroid. She was a donated dog at Purdue. I adopted her. She had problems. In her groin, in between her legs, she had a fold, and it was always, she'd get an odor, and I'd open up the fold and I'd take like wipes and clean it. But I literally took Gold Bond powder and I would sprinkle kind of her groin area with this powder to help absorb the moisture. So sometimes that can be done in these areas, but you can clean them. I also had wipes that I would wipe in between the folds. So like you can use, now you don't usually need something like Stridex, usually can use like Chlorohex wipes. Sometimes on her abdomen, I had babies at the time. I just used the baby wipes and I'd wipe, and then I kind of try to fan it because it just doesn't get air. And that's what the cornstarch or some type of a powder does. You can clean them and flush them. The problem is they're very difficult to treat because the folds aren't going away. And sometimes, again, in the summer months, it's worse than in the winter. But around the lips, that's a very difficult one, because if you do anything to the lips, immediately they're going to lick their lips. That's probably one of the hardest ones to treat. Again, if it becomes really bad, what you have to try to do is tell the owners you just want to clean them periodically, but you have to dry them. And you can, sometimes when I cleaned her with the wipe, I would take like a dry paper towel and just kind of pat it dry. And then I try to put the powder on. Try to keep, the problem is if they salivate in that area. The problem around the vulva is also the urine scald can affect it. So some areas are harder than others with the skin folds. And then let me just talk about deep pyodermas, which tend to come from a chronic infection. They tend to develop not just the tiny red bumps, but they actually get deeper pustules. A fistula tract it's kind of like a tract is like where the infection burrows deeper into the skin. And it can it usually comes from Staph intermedius. Now, Staphylococcus, I know you haven't, ClinLab 4, you guys go over microbiology. Staphylococcus aureus, Staphylococcus medius, staph are normal residents of the skin. Everybody has staph on their skin. If I took a swab of your skin and put it on a plate, I would probably grow staphs. And again, your immune system, and just because you're clean and you shower and whatever, I mean, we usually keep it in check. So the problem is when an animal has an allergy and they scratch and scratch and scratch and the skin gets inflamed, these staphs can then now penetrate to the deeper layers, and you can either get these superficial or deep pyodermas. And again, they usually come from a resident bacteria, and it takes hold and kind of goes gangbusters and it proliferates. So they usually are more painful, a deep pyoderma, because it's affecting the deeper layers of the dermis. The skin, because it's inflamed, they can be more sensitive to the touch. They can also have lymphadenopathy. So lymphadenopathy means the lymph nodes are swollen. And so if the skin is so infected, and the lymph nodes can get activated, and the lymph nodes can become tender and swollen. A lot of times this can come from demodex. They can also have a metabolic, they can be hypothyroid, and sometimes those animals are prone to deep pyodermas. Neoplasia is cancer. So there are certain cancers. There's a form of lymphoma called epitheliotrophic lymphoma. And I know that sounds crazy. It's actually lymphoma of the skin. And what happens is these dogs develop large, crusty, bleeding sores and swollen skin. And the problem is it doesn't respond to treatment. And then that it can be, again, it's more rare, but it is a form of lymphoma that is found within the skin layer. A lot of times to diagnose deep pyodermas, you can do skin impressions. You literally, in the area with all the pastules and pustules, you actually just put the slide on the skin, and you can look for the bacteria. You can do fungal cultures because, again, you may want to rule out, is this a fungal infection or is this a pyoderma? Have to rule that out. And then endocrine testing or biopsy. Endocrine testing is going to tell you, is this from Cushing's? Typically, you have to treat the underlying problem. Again, pyoderma isn't the main problem. Something made them scratching. My sister, her dog got a deep pyoderma, and he got groomed. He's a big, shaggy golden. And she goes, Christine, he's got bumps all over him. He's itching. I don't know what the heck's going on. And she told me he just got groomed. And I used to work for a groomer. And a lot of groomers will put the shampoo on and they will brush the dog with the shampoo. But the problem is they're using community shampoo and community brushes. And what happens, it's called actually furunculosis, but it's called post-grooming furunculosis. And they get this deep pyoderma or infection after a grooming. And again, it typically comes from the shared brushes, the shared shampoos. And so he had to be on 3 to 4 weeks of a very high-end, it's called Simplicef, which is a cephalexin type drug, except it's a once a day versus 3 times a day. And it was a long course, but like he had just been groomed the week before. And I was like, it pretty much follows the pattern. For you guys, I don't know if you guys have ever taken your dog to, like, I've sometimes taken my dog to, like, the pet store has the bathtub in the back where you can wash your own dog. I always bring my own shampoo and my own brush because they'll give you shampoo there. They'll give you brushes. I literally use my own shampoo and my own brush because, again, those shared products, even though it's soap, you don't think it would grow something. No, it can. So I don't ever use what they give me. I bring my own stuff. They have towels there. I will use their towels, although I bring my own towels because they give you this little tiny square of a towel. And I'm like, what am I supposed to do with this? I'm like, So I usually bring up anyway. That's just because sometimes if you know, also I didn't mention this, but the dog had been recently groomed or had been to one of these self-wash places and then they develop this deeper skin infection. It can sometimes originate after groomings and things. Again, this is usually a longer term issue. So we're talking about, like I said, he was on antibiotics and it was like 3 to 4 weeks of antibiotics. And then you may have to recheck. And sometimes they'll be continued for another 2, 3, 4 weeks. And again, now with my sister's dog, he was an older golden, but he had been groomed. So there was probably the reason behind it. You know, if you suspect Cushing's, if you suspect this skin lymphoma, you may have some other problems. There's some notes under here about, because I know we're out of time, that I do want you to read about dermatophytes. And on your, sorry, let me get out of this for a second. On your Moodle page, so I put the notes, the pyoderma notes that I just opened have some information about dermatophytes, which are fungi. I'm going to try to talk about those. And on your own, if you can read about ear infections down here, we may just have to kind of go through the homework and I'll try to answer the questions that I can. Are there any questions as far as our plan?